If you're over 50 and you've been feeling more tired than usual, if you've noticed your vision getting a little blurry, or maybe you're getting up several times during the night to use the bathroom, I want you to pay close attention to what I'm about to share with you today. These could be signs that your blood sugar is running higher than it should be, and the tricky thing is, many people have no idea this is happening inside their body. Today, I'm going to walk you through 12 warning signs that your blood sugar may be too high. Some of these are obvious, but others might really surprise you. And more importantly, I'll share what you can do about it. So let's go through this together, step by step. Hello, my friend, and welcome back. I'm Dr. Sarah Truman, and I'm so glad you're here with me today. Before we dive in, I want to be very clear about something important. I'm a health coach and wellness educator. I'm not a medical doctor, and this video is not medical advice. Everything I share today is for general educational purposes only. Please talk to your own doctor or healthcare provider before making any changes to your diet, your exercise routine, or trying any new supplement, especially if you have any health conditions or if you take medications. Your doctor knows your personal situation best, and nothing I say here replaces their guidance. I want to be your partner in learning, not your physician. Fair enough? Now, today's topic is something that affects millions of people, and yet so many don't even realize it's happening. We're talking about high blood sugar, and specifically the warning signs that your body might be giving you right now. This matters so much for those of us over 50 because as we age, our bodies don't always process sugar the way they used to. And catching these signs early can make a real difference in how you feel every single day and in your long-term health. Here's what we'll cover today. First, I'll explain why blood sugar tends to become more of a concern as we get older. Then we'll go through 12 specific warning signs, one by one, so you know exactly what to look for. After that, I'll share some common mistakes people make when trying to manage their blood sugar. And finally, I'll tell you when it's really important to see your doctor right away. Sound good? Let's get started. So let me take a moment to explain why blood sugar becomes such a concern for many of us as we get older. Think of blood sugar or glucose as the fuel your body uses for energy. When you eat food, especially carbohydrates, your body breaks it down into glucose. That glucose travels through your bloodstream to your cells, where it's used for energy. Now, for this process to work properly, your body needs a hormone called insulin. Insulin is like a key that unlocks your cells so the glucose can get inside. Here's what happens as we age. For many people, this system doesn't work quite as efficiently as it used to. Your cells might become a little resistant to insulin, meaning the key doesn't fit the lock as well as it once did. When this happens, glucose starts to build up in your bloodstream instead of getting into your cells where it's needed. This is what we mean by high blood sugar. Now, I want to reassure you that this is incredibly common. Millions of people over 50 experience some degree of blood sugar imbalance. You're not alone, and there's no shame in it. The important thing is awareness. When you know what signs to look for, you can take action sooner. And the good news is that for many people, simple lifestyle changes can make a real difference in how they feel and how their body manages blood sugar. Some factors that contribute to blood sugar challenges include things like carrying extra weight, especially around the middle, being less physically active than we used to be, eating more processed foods and sugars, not getting enough quality sleep, and experiencing chronic stress. All of these can affect how your body handles glucose. But here's the encouraging part. These are all things we have some control over. Small changes in these areas can often lead to noticeable improvements. Now let's talk about the first warning sign that your blood sugar might be running too high, and this is one of the most common ones. I'm talking about feeling excessively thirsty, even when you're drinking plenty of water. You might feel like no matter how much you drink, you just can't seem to quench your thirst. Here's why this happens. When there's too much glucose in your blood, your kidneys have to work overtime to filter it out. They try to flush out the excess sugar through your urine, and this process pulls a lot of water from your body. So you end up urinating more frequently, which leads to dehydration, which then makes you feel incredibly thirsty. It becomes a cycle. If you've noticed that your thirst seems unusual, that you're reaching for water constantly throughout the day and night, This is worth paying attention to. Now, I'm not saying that being thirsty automatically means you have a blood sugar problem. There are many reasons you might be thirsty, including not drinking enough fluids, eating salty foods, or certain medications. But if this excessive thirst is persistent and you can't explain it, it's a good idea to mention it to your doctor. In the meantime, here's what you can do. First, keep a water bottle with you and sip throughout the day rather than gulping large amounts at once. Second, limit sugary drinks like sodas, sweet teas, and fruit juices, which can actually make the problem worse. Third, pay attention to how often you're going to the bathroom. If it's much more frequent than usual, especially at night, make a note of it. And fourth, consider keeping a simple log for a few days, noting how much you drink, how often you urinate, and how thirsty you feel. This information can be really helpful for your doctor. Remember, staying hydrated is important for everyone, but if your thirst feels out of control, that's your body trying to tell you something. The second warning sign is closely related to the first, and that's urinating much more frequently than normal. This is called polyuria in medical terms, but let's just call it what it is, going to the bathroom a lot, especially during the night. As I mentioned, when your blood sugar is high, your kidneys work hard to filter out the excess glucose. They produce more urine to flush that sugar out of your body. So you might find yourself getting up 2, 3, 4, or even more times during the night to use the bathroom. During the day, you might feel like you need to go every hour or two. This can be exhausting. It disrupts your sleep, which affects your energy levels, your mood, and even your ability to think clearly. And it can really impact your quality of life if you're constantly worried about being near a bathroom. Now, frequent urination can have many causes, including prostate issues in men, urinary tract infections, certain medications, and simply drinking more fluids. So don't jump to conclusions. But if this is new for you, if it's getting worse, or if it's happening along with other symptoms we're discussing today, please bring it up with your healthcare provider. What can you do in the meantime? Try to limit fluids in the 2 to 3 hours before bedtime. Avoid caffeine and alcohol in the evening, as these can increase urination. When you do go to the bathroom, take your time and make sure your bladder empties completely. And if getting up at night is affecting your sleep quality, talk to your doctor. There may be simple solutions that can help. The third warning sign is fatigue that doesn't seem to go away no matter how much you rest. I'm not talking about being tired after a busy day or a poor night's sleep. I'm talking about a deep, persistent exhaustion that makes even simple tasks feel overwhelming. Here's what's happening in your body. Remember, glucose is your cell's main source of energy. When blood sugar is high, but that sugar isn't getting into your cells efficiently, your cells are essentially starving for fuel. Even though there's plenty of glucose in your bloodstream, your body can't use it properly. So you end up feeling tired, weak, and drained, even if you've been resting. Many people describe this as feeling like they're running on empty. You might wake up feeling tired even after a full night's sleep. You might find yourself needing to sit down and rest frequently throughout the day. Activities that used to be easy might now feel like climbing a mountain. If this sounds familiar, I want you to know that this kind of fatigue is not a normal part of aging that you just have to accept. Yes, we might have a little less energy than we did in our 20s, but persistent, unexplained exhaustion is your body telling you something isn't right. What can you do? First, pay attention to when your fatigue is worst. Is it after meals, first thing in the morning, all day long? This information can be helpful. Second, try to stick to a regular sleep schedule, going to bed and waking up at the same times each day. Third, consider gentle movement, like a short walk after meals. This can actually help your body use glucose more efficiently. And fourth, look at what you're eating. Meals heavy in refined carbohydrates and sugars can cause blood sugar spikes and crashes that leave you feeling wiped out. The fourth warning sign might surprise you, and it's one that many people overlook. I'm talking about blurry vision or changes in your eyesight. Have you noticed that your vision seems a little fuzzy sometimes? Maybe things look clear one day and blurry the next? This could be related to your blood sugar levels. Here's why this happens. When blood sugar is high, it can cause the lens inside your eye to swell. This swelling changes the shape of the lens, which affects your ability to focus clearly. It's almost like your eyes are trying to look through a camera lens that keeps changing shape. One day things might look fine, and the next day everything seems a bit out of focus. This type of vision change is often temporary. When blood sugar levels come back down, your vision often improves, but if high blood sugar continues over time, it can lead to more serious eye problems. That's why it's so important to pay attention to these early signs. If you've noticed vision changes, here's what I suggest. First, don't panic. Many causes of blurry vision are temporary and treatable. Second, schedule an eye exam if you haven't had one recently. Eye doctors can often detect signs of blood sugar issues during a routine exam. Third, note when your vision problems occur. Is it worse at certain times of day, after certain meals? This information helps. And fourth, please don't ignore persistent vision changes. Your eyesight is precious, and any ongoing changes deserve medical attention. The fifth warning sign is slow healing. Have you noticed that cuts, bruises, or small wounds seem to take forever to heal? Maybe a little scrape that should have healed in a few days is still there after 2 weeks? This can be a sign that your blood sugar is running high. When there's too much glucose in your blood, it can damage your blood vessels and affect your circulation. Good blood flow is essential for healing because your blood carries the oxygen and nutrients your body needs to repair damaged tissue. When circulation is compromised, the healing process slows down significantly. High blood sugar can also affect your immune system, making it harder for your body to fight off infections. So not only do wounds heal more slowly, but they're also more likely to become infected. If you've noticed slow healing, here are some steps to take. Keep any wounds clean and properly bandaged. Check your feet daily for any cuts, blisters, or sores, especially if you have reduced sensation in your feet. Don't ignore minor wounds. Even small ones deserve attention. And if you notice any signs of infection like increased redness, warmth, swelling, or pus, see your doctor right away. Now let's talk about the sixth warning sign, which is numbness or tingling in your hands or feet. Some people describe this as a pins and needles sensation, like your hand or foot fell asleep. Others describe it as a burning or prickling feeling. It might come and go, or it might be constant. This symptom occurs because high blood sugar can damage your nerves over time, a condition called peripheral neuropathy. The nerves in your hands and feet are often affected first because they're the farthest from your heart, where blood has to travel the longest distance. When these nerves are damaged, they send abnormal signals, causing those strange sensations. This is something to take seriously because nerve damage can progress if blood sugar remains high. Over time, numbness can make it harder to feel injuries to your feet, which increases the risk of infections and other complications. If you're experiencing numbness or tingling, please mention it to your doctor. They can do simple tests to check your nerve function. In the meantime, check your feet daily for any injuries you might not feel. Wear comfortable, well-fitting shoes to protect your feet. Avoid walking barefoot, even at home. And be careful with heating pads or hot water, as you might not feel if something is too hot. The seventh warning sign is unexpected weight loss. Now, I know many of us are trying to lose a few pounds, but I'm talking about weight loss that happens without trying. You haven't changed your diet or exercise, but the pounds are dropping off. While this might seem like a welcome surprise, unexplained weight loss can actually be a warning sign. Here's what might be happening. When your body can't get glucose into your cells for energy, it starts looking for alternative fuel sources. It may begin breaking down muscle and fat to get the energy it needs. The result is weight loss, even if you're eating normally or even more than usual. If you've lost weight without trying, especially more than 5 to 10 pounds over a few months, this is worth investigating. Keep track of your weight and bring this up with your healthcare provider. They may want to check your blood sugar levels and rule out other possible causes. The eighth warning sign is increased hunger even after you've just eaten. Does this sound familiar? You finish a meal, but 30 minutes later you're starving again, or maybe you're constantly thinking about food, even when you've eaten plenty. This happens for the same reason high blood sugar causes fatigue. Your cells aren't getting the glucose they need, so they keep sending hunger signals to your brain, asking for more fuel. The problem is, eating more won't solve the issue if the glucose can't get into your cells. So you end up in this frustrating cycle of eating, feeling hungry, eating more, and still feeling hungry. If you're experiencing this kind of intense hunger, try to focus on foods that won't cause blood sugar spikes. Choose meals with protein, healthy fats, and fiber. Avoid highly processed foods and sugary snacks. Eat regular meals at consistent times. And pay attention to whether certain foods leave you feeling more satisfied than others. The ninth warning sign is frequent infections. This might include recurring urinary tract infections, yeast infections, skin infections, or gum disease. If you seem to get these kinds of infections more often than you used to, your blood sugar might be part of the picture. High blood sugar creates an environment where bacteria and yeast can thrive. Sugar is food for these organisms, so when there's more sugar in your system, infections become more likely. Additionally, high blood sugar can weaken your immune system, making it harder for your body to fight off these invaders. If you're dealing with frequent infections, please see your healthcare provider. They can help treat the infections and investigate whether blood sugar might be a contributing factor. In the meantime, practice good hygiene, keep your skin clean and dry, stay well hydrated, and take any infections seriously rather than trying to wait them out. The 10th warning sign is dry, itchy skin. Our skin tends to get drier as we age anyway, but persistent, uncomfortable dryness and itching can be related to high blood sugar. This happens because of the dehydration caused by frequent urination and also because of reduced circulation, which affects your skin's ability to stay healthy and moisturized. If your skin feels constantly dry and itchy even when you use moisturizer, here are some things to try. Use gentle, fragrance-free soaps and lotions. Don't take very hot showers or baths, as hot water strips moisture from your skin. Apply moisturizer right after bathing while your skin is still slightly damp. Stay hydrated by drinking plenty of water, and if the itching is severe or you develop any rashes or sores, have your doctor take a look. The 11th warning sign is dark patches of skin, particularly in areas where your skin folds or creases. This might include the back of your neck, your armpits, your groin area, or under your breasts. These patches often have a velvety texture and are darker than your normal skin tone. This condition is called acanthosis nigricans, and it's often associated with insulin resistance, which is when your body isn't using insulin effectively. The extra insulin in your bloodstream can cause these skin changes. It's not dangerous in itself, but it's your body's way of signaling that something is off with how it's processing glucose. If you notice these dark patches, don't be embarrassed to mention them to your doctor. They're a helpful diagnostic clue and can lead to earlier detection and treatment of blood sugar issues. The 12th and final warning sign I want to discuss today is cognitive changes. This might include difficulty concentrating, feeling foggy or confused, trouble remembering things, or just not feeling as mentally sharp as you used to. Your brain needs a steady supply of glucose to function properly. When blood sugar levels are consistently high or when they swing dramatically up and down, your brain doesn't get the stable fuel it needs. Over time, this can affect your thinking, your memory, and your overall mental clarity. Many people chalk these changes up to normal aging, but while some cognitive changes are common as we get older, significant difficulties with thinking and memory deserve attention. If you or your loved ones have noticed changes in your mental sharpness, please mention this to your doctor. They can help determine what's causing these changes and what can be done about them. Now, before we move on, I want to talk about some common mistakes people make when it comes to blood sugar and some myths that need clearing up. The first mistake is thinking that blood sugar problems only affect people who eat a lot of sugar. While eating excessive sugar certainly doesn't help, blood sugar issues are more complicated than that. They can be influenced by genetics, stress, sleep, activity level, and many other factors. Someone who rarely eats dessert can still develop blood sugar problems, and someone who occasionally enjoys sweets might have perfectly normal blood sugar. It's not as simple as avoiding sugar equals no blood sugar problems. The second mistake is assuming you definitely know if something was wrong. The truth is, blood sugar can be elevated for years without causing obvious symptoms. Many of the signs we discussed today are subtle and easy to dismiss as normal aging or stress or just being busy. That's why regular checkups and blood sugar screenings are so important, especially after age 50. The third mistake is thinking that if you're not overweight, you don't need to worry about blood sugar. While carrying extra weight is a risk factor, people of all sizes can develop blood sugar issues. Some people call this thin on the outside, fat on the inside, meaning you can have metabolic problems even if you look healthy. Don't assume your weight tells the whole story. And the fourth mistake is trying to manage blood sugar concerns entirely on your own without medical guidance. While lifestyle changes are incredibly powerful, and I'm a huge believer in the impact of diet, exercise, and stress management, it's really important to work with your healthcare provider. They can monitor your levels, check for any complications, and help you create a plan that's safe and effective for your individual situation. Now, this brings me to a very important part of our conversation today. I want to talk about when you really need to see your doctor right away. Please seek medical attention promptly if you experience any of the following: extreme thirst that doesn't go away no matter how much you drink, urinating so frequently that it's disrupting your life, or if you notice a fruity smell to your urine, sudden, unexplained weight loss of more than 10 pounds, vision changes that are severe or come on suddenly, any wound that shows signs of infection or that isn't healing after 2 weeks, severe fatigue where you can barely function, confusion, difficulty thinking clearly or feeling disoriented, nausea, vomiting, or abdominal pain combined with any of the other symptoms we discussed, or any combination of the symptoms we talked about today that seems to be getting worse. Trust your instincts. If something doesn't feel right, it's always better to get it checked out. Don't wait and hope it goes away. Your health is worth a phone call to your doctor. Let me quickly recap what we covered today. We talked about 12 warning signs that your blood sugar may be too high. Number 1 was excessive thirst that you just can't seem to quench. Number 2 was frequent urination, especially at night. Number 3 was persistent fatigue that doesn't improve with rest. Number 4 was blurry or changing vision. Number 5 was slow healing of cuts and wounds. Number 6 was numbness or tingling in your hands or feet. Number 7 was unexpected weight loss. Number 8 was increased hunger even after eating. Number 9 was frequent infections. Number 10 was dry, itchy skin. Number 11 was dark patches of skin in body folds. And number 12 was cognitive changes like difficulty concentrating or memory problems. Remember, having one or even a few of these symptoms doesn't necessarily mean you have a serious blood sugar problem. Many of these symptoms can have other causes. But if you're experiencing several of these signs, or if any of them are persistent or severe, it's definitely time to have a conversation with your doctor. The wonderful news is that blood sugar levels often respond well to lifestyle changes. Things like eating more whole foods and fewer processed ones, staying active with regular movement throughout the day, managing stress, getting enough quality sleep, and maintaining a healthy weight can all make a real difference for many people. These aren't quick fixes, but they're sustainable changes that can improve how you feel overall. Be patient with yourself. You don't have to overhaul your entire life overnight. Start with one small change that feels manageable. Maybe it's taking a 10-minute walk after dinner. Maybe it's swapping your afternoon cookie for a handful of nuts. Maybe it's going to bed 30 minutes earlier. Small steps add up over time. If you found this information helpful, I would be so grateful if you'd give this video a thumbs up. It really does help other seniors find this information, and I believe this is something everyone over 50 should know about. And if you're not subscribed yet, consider joining our community here. I share new videos every week focused on helping you stay strong, healthy, and independent as you age. We're all in this together, and I'm honored to be part of your wellness journey. If you'd like to keep learning, I recommend watching my video on simple daily habits that may help support healthy blood sugar naturally. I'll put the link on the screen and in the description below. Thank you so much for spending this time with me today. Remember, knowledge is power, especially when it comes to your health. The fact that you watched this video and learned about these warning signs means you're already taking an important step in caring for yourself. Take care of yourself, listen to your body, and don't hesitate to reach out to your healthcare provider if you have any concerns. I'll see you in the next video. Until then, be well, my friend.